Colleen Hoover has emerged from a challenging health battle with an overwhelmingly positive message for her fans and followers. The renowned author, celebrated for her emotionally charged novels that have captivated millions around the world, recently opened up about completing her treatment for cancer and declaring that the disease is no longer present in her body. This update marks a triumphant turning point after a period of uncertainty, medical interventions, and personal reflection that she has shared selectively but candidly through her social media channels. The journey began sometime the previous year when Hoover received her diagnosis for an unspecified form of cancer. She underwent successful surgery as the initial step in addressing the condition, which proved effective in removing the primary source of the illness. Following that procedure, she progressed into a course of radiation therapy, a rigorous treatment regimen designed to target any remaining cancerous cells and prevent recurrence. She documented parts of this experience, including nearing the conclusion of her radiation sessions, where she expressed a mix of exhaustion and optimism. In one instance, she shared a light-hearted comment about her appearance during treatment, noting that any changes to her hair or expressions were not solely attributable to the medical process but perhaps her own natural state at the time. She praised the professionalism and care provided by her oncology team, recommending them highly while hoping others never have need of such services. Once the final radiation session wrapped up, Hoover wasted no time in sharing the relieving news. She explicitly stated that she no longer has cancer. The surgery had been a success, the radiation course was complete, and in her words, everything was now good and had been progressing well throughout. She conveyed deep gratitude toward her doctors, emphasizing that they had performed their roles exceptionally, bringing a sense of closure and victory to what could have been a far more daunting ordeal. Her tone carried a celebratory edge, underscoring relief and a return to normalcy after months of medical focus. This declaration came amid some misleading reports circulating in the media that painted a far grimmer picture of her condition, suggesting she was in a dire or terminal state. Hoover addressed these directly, countering the exaggeration by clarifying the facts of her situation. She stressed that while the experience had been serious and required significant intervention, the outcome was favorable, and she was moving forward without the shadow of active disease. Her response served not only to set the record straight but also to reassure her large community of readers who had expressed concern and support during her quieter periods. Earlier in the process, Hoover had delved into some of the investigative details surrounding her diagnosis. Genetic testing revealed that the cancer did not stem from hereditary factors within her family lineage. Additionally, it was not linked to two of the most common causes associated with this particular type of cancer, namely HPV infection or excessive hormonal influences. By process of elimination, she concluded that environmental or lifestyle elements were the more probable contributors. These included factors such as insufficient physical activity, a less-than-ideal diet, and the cumulative effects of stress over time. Acknowledging these insights brought a moment of introspection, as she recognized the need for meaningful changes to safeguard her long-term health. Despite the clarity of the findings, Hoover approached the required adjustments with her characteristic humor and honesty. She admitted to a genuine dislike for many of the healthy habits now recommended. Vegetables held little appeal, leaving the comfort of the couch felt burdensome, and sweating during exercise was far from enjoyable. She poked fun at her own resistance to these shifts, joking that science had an annoying habit of being correct even when inconvenient. She anticipated potential awkward encounters at the gym or while opting for grilled chicken and water at restaurants, where well-meaning congratulations might only heighten her frustration with the enforced lifestyle overhaul. Her candid admissions resonated with many, humanizing the often idealized image of someone navigating serious illness while maintaining a public persona. The health challenges had tangible impacts on her professional commitments as well. Hoover had to step back from certain high-profile events tied to adaptations of her work. For instance, she missed the premiere and related promotional activities for a film based on one of her novels, citing the unavoidable nature of her surgery and the subsequent recovery period that restricted travel. She expressed genuine disappointment at not being able to attend in person but encouraged fans to share their reactions and experiences with the project, allowing her to connect vicariously through their stories. She extended heartfelt thanks to the cast and crew involved, recognizing their efforts in bringing her story to the screen despite her absence. Throughout this period, Hoover's communication remained selective yet warm, balancing privacy with transparency. She avoided delving into excessive medical specifics beyond what was necessary to explain her situation, instead focusing on gratitude, forward momentum, and the importance of reliable medical care. Her updates often blended vulnerability with levity, a style consistent with the emotional depth found in her writing. Fans responded with an outpouring of encouragement, sharing messages of solidarity and well wishes that undoubtedly bolstered her during tougher moments.